TMJ disorder is a general term that we use for dysfunction of the temporomandibular joint. So that's the joint right in front of your ear where your jaw hinges. It's a really complex joint. So it not only rotates, but it does what's called translation, which means that the kind of ball joint in the ball and socket moves physically forward as you open your mouth.
My job as an oral facial pain specialist, or as our oral surgeons who treat TMJ disorders do, our job is to specifically diagnose and find out what the actual and exact problem is. Symptoms of TMJ disorders can include aching, different types of pain in the jaw, aching, throbbing, tightness, fatigue. Sometimes that pain can even be experienced or appear to be in the ear because of the location of the TMJ.
From a functionality standpoint, it may result in a change in our bite. It may restrict our mouth opening, or some combination of all the above.
A TMJ disorder is an umbrella term. So underneath that, we'll try to diagnose exactly what is going on. And then from there, we can decide on treatments.
The initial visit that I have with someone who has TMJ disorders, who has pain or limited opening, that kind of thing, is a pretty long initial consultation. So we take some imaging to see what the bony anatomy looks like. We will usually get an MRI, although we can't get that in the office. A lot of times we'll get it for patients after they first see us. There's still a lot that we can do diagnostically and have a conversation with patients about what's possible, what's out there, and what we can help with. That includes obviously going through medical history, doing a 15-point or so exam where we do measurements of people's functional movements, their opening, their ability to move their jaw side to side and forward. We listen for joint noise to see if they have clicking, popping, or grinding. We look in the inner ear to see if there's any inner ear dysfunction. And then we look in the mouth of the dentition, see if things line up. It's common that sometimes a malocclusion or someone's bite being off can contribute to TMJ disease. And so we'll evaluate for that.
Hopefully, our patients can be treated with something simple. In fact, most TMJ patients have an issue that's relatively straightforward to treat.
Most often what we'll see in the office is something acute. Those are fairly common in the population. Acute TMJ disorder means something that just recently started. I would say the majority of cases where we can clearly define an event that started the temporomandibular disorder, those are generally well treated and have a great prognosis for full recovery. And most of those cases need anti-inflammatory, muscle relaxant, maybe a couple minimal things in close monitoring, as we've already ruled out if there's any sort of a jaw fracture or significant issue. Now moving over to chronic temporomandibular disorders, acute disorders can turn into chronic disorders. That is not generally the case. Chronic temporomandibular disorders are cases that have been around for years and years and years. And even a chronic temporomandibular disorder does not mean you need surgery.
It's definitely more predictable and easier to treat a patient who has an acute problem and comes to you soon rather than them trying to deal with the pain and dysfunction for a long period of time, and then we have to kind of try to wind back the clock there. Sleep disorders and TMJ disorders are kind of commonly found in similar types of patients. A lot of patients who don't get good sleep will get worsening TMJ disease from not getting enough sleep is essentially what happens.
Sometimes it can wake you during the night if you're clenching and grinding, but usually it's quite symptomatic, painful, irritating in the evening, afternoon, evening time, and when you're going to bed. And so those can be challenging times for patients to fall asleep.
The things I see that patients commonly do that makes their TMJ disorder worse is chewing on really chewy foods. So a lot of times chewing gum, baguettes, things like that, bagels, stuff like that is going to aggravate. A lot of times, like we sort of discussed, poor sleep quality will make TMJ disorders worse. stress definitely makes TMJ disorders worse. People who clench and grind their teeth, that always makes TMJ disorders worse, it seems like. And those things can be hard for a patient to kind of control on their own.
As soon as you experience TMJ symptoms, you really should seek out care from a provider.
Being able to manage that stress, a lot of times with the sort of help of like an oral maxillofacial surgeon or orofacial pain provider, we have some things that we can offer to help with that. That's really important. I'd say that's the most important thing to keep that dysfunction and pain under control.